A cure from the past, aspirin. Scientists' opinion. Interesting about science and medicine prepared by this over page all scientific. Science when has aspirin been used? Aspirin acetylsalicylic acid is one of the most common and long-used medication. What is aspirin? It belongs to the group of nonsteroidal anti-inflammatory drugs and it used to relieve pain, reduce fever and reduce inflammation. However, despite its effectiveness, aspirin's use is associated with a number of limitations and possible side effects. Let us take a closer look at its positive and negative aspects. Pain relieving effect. Aspirin effectively relieves headache, toothache, muscle pain and inflammatory pain. It is often used for migraine and other pains, unless contraindicated. Antipyretic effect. Yes, thanks to its effect on the thermoregulatory center, aspirin helps reduce elevated body temperature during infectious and inflammatory disease. Anti-inflammatory action. The medication reduces inflammation, so it is used for rheumatism, arthritis, and other musculoskeletal conditions associated with inflammation and pain. Positive effect on skin. In some cases, aspirin helps reduce inflammation associated with acne. It can be made into a paste for external use, which helps relieve itching after insect bites. Due to its salicylic acid content, aspirin can be used in home remedy to soften calluses and raw skin. Effect on viral infection. According to studies, taking low doses of aspirin, about 150 mg per day, can reduce the active period of the herpes virus by almost half, thereby alleviating the disease. Prevention of cardiovascular disease. In small doses, aspirin is used to thin the blood and prevent thrombosis. It may reduce the risk of myocardial infarction, stroke, and other complications associated with blood clots. Harm and potential risk of aspirin. Despite its many positive effects, aspirin can cause significant harm if used incorrectly or in excess. Negative effects on the stomach and intestine. Aspirin irritates the stomach, lining and can cause gastritis, ulcer, and stomach bleeding. Frequent and or uncontrolled use increases the risk of this complication. Allergic reaction and bronchospasm. In approximately 5% of people with asthma, taking aspirin and other NSAIDs can cause an asthma attack. Skin rashes, swelling, and other allergic reactions are possible. Danger to children. Aspirin is strictly prohibited for children under 16 years of age, as it can cause a rare but dangerous complication called Reye syndrome, which affects the liver and brain. Reproductive dysfunction. Aspirin is contraindicated for women planning pregnancy. It can interfere with ovulation and prevent the fertilized egg from attaching to the uterine wall. Rebound headaches. Frequent use of aspirin and ibuprofen can lead to the development of withdrawal headache. As soon as the medication effect wears off, a new headache occurs, creating a vicious cycle. Dangerous for gout. Aspirin is contraindicated for gout, as it slows the elimination of uric acid from the body and can trigger a worsening of the condition. Risk of bleeding. Aspirin affects blood clotting. People prone to nosebleeds or those with bleeding disorder should use it with extreme caution and only as prescribed by a doctor. Burns when applied externally. Although aspirin can be used as a remedy for bites or blisters, it can cause burns or skin irritation if it comes into contact with healthy skin or is used by people with allergy. Recommendation for taking aspirin. Aspirin is a versatile medication that has broad and enormous benefit to medicine and is still widely used. It helps with pain, inflammation, and fever, can improve skin condition, and even reduce the risk of blood clots. However, its side effects are also wide-ranging, from stomach irritation and allergy to dangerous consequences for children and people with certain medical conditions. Therefore, aspirin should only be used in recommendation doses. It should not be used long-term without consulting a doctor. Individual contraindication must be considered. Conclusion. Aspirin is a medication when used correctly, can be a reliable aid, but when used carelessly, it can cause serious harm. Thank you for your attention. This material is based on material from the channel All-Scientifical. Caution: before using any treatment methods or medication, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.